How to start your home care agency in Minnesota. If you're planning to start a home care agency in Minnesota, this is not a state where you can rely on generic startup advice. Minnesota regulates home care very specifically under Chapter 144A of the Minnesota Statutes, and those laws determine whether you need a license, what services you can provide, how you staff, and even how you advertise your business. In this video, I'm breaking down the Minnesota statutes in plain language so you understand exactly how to start a home care agency legally and compliantly from day one. Let's get started. Minnesota has two types of home care licenses. The license a home care provider holds depends on the types of services offered. 1. Basic home care license. This is the license most non-medical home care agencies need in Minnesota. It allows agencies to provide routine personal care and supportive services, including help with daily activities like dressing, grooming, toileting, bathing, and eating. It also covers standby assistance for safety, medication and treatment reminders, exercise reminders, modified diet preparation when ordered, and household support such as laundry, housekeeping, meal prep, and shopping. 2. Comprehensive home care license. This license applies when your agency provides a higher level of clinical oversight. This license comes with additional policy, staffing, and supervision requirements and is not necessary for most non-medical startups. This license is appropriate for agencies that provide medically complex care and require structured clinical supervision. Minnesota recognizes two other pathways that may apply depending on your business model. Home management services registration. This option is limited to agencies that provide only housekeeping, meal preparation, and shopping. You must provide at least two of these services, and you may not provide personal care, supervision, or hands-on assistance. The moment you expand beyond this scope, you are no longer eligible for this registration. You must comply with annual submission of basic business info and a signed statement acknowledging the Bill of Rights. Individuals providing home management services must attend required orientation on Bill of Rights, plus aging process, needs of elderly and disabled persons within 120 days after beginning services. 2. Home and Community-Based Services, HCBS. An integrated license is a Minnesota home care license with an added HCBS designation. It allows a home care agency to provide basic support services in addition to home care services. The agency must still meet all home care licensing requirements and must provide at least one home care service to every client. The integrated license is not a shortcut to avoid licensing, a way to only provide HCBS services, a replacement for DHS 245D licensure, or a pathway for agencies that do not want to provide home care. Before we move on, there is an important update related to HCBS and 245D licensing that you need to be aware of. Starting January 1st, 2026, Minnesota DHS implemented a temporary moratorium on new 245D HCBS licenses in effect through December 31st, 2027. During this period, new providers are generally unable to obtain 245D licensure unless DHS establishes specific exceptions. Even with the new 245D moratorium, the rules around integrated licenses have not changed. The most important decision you will make at the beginning of this process is choosing the correct MDH home care pathway based on the services you plan to provide. Minnesota does not allow a one-size-fits-all approach. Your license must match your services exactly. Once you've identified the correct Minnesota home care licensing path for your agency, the next major decision you need to make is how your agency will be paid. Decide whether your agency will operate as private pay only or whether you plan to pursue Medicaid reimbursement through Minnesota healthcare programs, also known as MHCP. Many new agencies choose to start as private pay only, and this is often the simplest way to launch. Even as a private pay agency, you must still obtain the correct MDH license or registration, use compliant service agreements and client contracts, hire and train staff according to Minnesota requirements, complete required background studies. The difference is that you are paid directly by clients or families, not by the state. Private pay does not mean unregulated. All MDH licensing rules still apply. Medicaid reimbursement, MHCP. If you plan to bill Medicaid, your agency must enroll with Minnesota Healthcare Programs, or MHCP, after meeting MDH licensing requirements. MHCP enrollment is a separate process managed by the Minnesota Department of Human Services and has its own provider eligibility requirements, training and documentation standards, enrollment applications, and approval timelines. For example, agencies that want to operate as PCA provider agencies must meet DHS-specific criteria and complete the PCA enrollment process. Medicaid enrollment does not replace MDH licensing. You must be licensed first. Many agencies choose to start private pay, become operational, and then pursue MHCP enrollment once they understand their systems and staffing. Others build Medicaid into their model from the start, but that requires more time, preparation, and compliance oversight. Once you've decided whether your agency will operate as private pay only or pursue Medicaid reimbursement, the next step is to legally form your business and prepare for licensing. Business formation essentials. Most home care agencies choose to form a limited liability company, or LLC, but the exact structure is a business decision you should make with professional guidance. At a minimum, you will need to register your business with the Minnesota Secretary of State. Ensure your business name is approved and active. Use a consistent address across all applications. Inconsistent information is one of the most common reasons licensing applications are delayed. Once your business is officially registered, the next step is setting up your Minnesota tax accounts. Even if your home care services are private pay, Minnesota still requires you to register your business with the Department of Revenue. This includes obtaining a Minnesota tax ID and registering for employer withholding if you plan to hire staff. Many home care agencies fail audits or run into payroll issues because tax registration was not handled correctly at the beginning. Preparing for licensing, policies, staffing, and background studies. With your business and tax accounts established, you can now focus on the most critical part of the startup process, licensing readiness. Minnesota expects agencies to be operationally ready before submitting a license application. Licensing is not just paperwork, it's proof that your agency understands and can comply with state requirements. Policies and procedures. Your policies must address client rights and the Home Care Bill of Rights, intake and service planning, staff orientation, training and competency, background studies, incident and complaint handling, maltreatment reporting, and infection control. These policies must exist at the time of application, not after approval. Minnesota law requires every home care provider to follow the Minnesota Home Care Bill of Rights. This includes a client's right to be informed of services and costs, participate in care planning, receive services with dignity and respect, file complaints without retaliation, refuse services, or change providers. You must provide this information before services begin, and it must be incorporated into your intake process and policies. Service plans, staffing, and training requirements. Minnesota law requires a written service plan for every client, documentation that staff know and follow that plan, training and competency verification for caregivers, ongoing supervision appropriate to the services provided. Staff must receive orientation to home care laws and client rights, training specific to the services they perform, supervision that verifies competency, not just attendance. Owners, managers, administrators, and many direct care staff must complete Minnesota background studies before working with clients. These are completed through the state's background study system and must be cleared before a license can be issued. This is a frequent cause of application delays when not handled early. Minnesota expects agencies to be survey ready, even if a survey is not immediately scheduled. Background study requests are submitted through NetStudy 2.0. Once your policies, staffing structure, and background studies are in place, the next step is preparing for launch. This is where we shift from regulatory compliance to what both regulators and clients expect your agency to have on day one. Before you serve your first client, your agency should have appropriate insurance and risk controls in place. Even for non-medical home care, risk exists, and Minnesota regulators and private pay clients expect agencies to carry coverage. At a minimum, most agencies secure general liability insurance, professional liability insurance, workers' compensation if you have employees, and bonding, which is often requested by private pay clients and families. Insurance requirements may vary based on your services and staffing model, so this is another area where professional guidance is strongly recommended. Next, your agency must have clear, compliant contracts and internal documents before launching. These documents protect your business, your staff, and your clients and include a client service agreement outlining services, pricing, and cancellation terms, a caregiver handbook including confidentiality expectations and a code of conduct, and properly structured employment or independent contractor agreements. Many agencies choose W-2 employees due to the level of control and supervision required in home care. Independent contractor arrangements must be structured carefully to avoid misclassification issues. Once your policies are complete and background studies are in progress and your insurance, contracts, and marketing are aligned with your license scope, you're ready to submit your MDH application and move toward approval. All home care applications are submitted using official MDH forms and uploaded through the state's licensing portal. MDH can request additional information or meetings to assess knowledge and compliance. Once MDH determines your application is complete, they have up to 60 days to issue or deny the temporary license. Incomplete applications are the #1 reason for delays. After approval, agencies must notify MDH when they begin serving their first client, maintain compliance with all licensing requirements, provide services during each license period to remain eligible for renewal. Minnesota expects agencies to be survey ready at all times, not just when a survey is announced. Once your agency is licensed, staffed, and ready to accept clients, it's time to begin marketing your services. At this stage, your focus shifts from regulatory readiness to visibility and relationship building in your community. Common post-licensure marketing steps include building a professional website that clearly outlines your approved services, setting up a Google business profile so your agency appears in local searches, printing brochures and business cards for community outreach, networking with hospitals, hospice agencies, senior centers, rehabilitation facilities, and discharge planners, joining local chambers of commerce and health-related associations, and asking satisfied clients and families for reviews and referrals once services are established. Marketing must match your license scope. One area that often gets overlooked is marketing, but in Minnesota, this matters. State law does not just regulate the services you provide, it also addresses advertising yourself as a home care provider. Your website, brochures, and promotional materials must accurately reflect the license or registration you hold and the services you are approved to provide. You should not advertise services outside your approved scope, even if you plan to offer them later. Misaligned marketing can create compliance issues before you ever serve your first client. Launch readiness is not just about passing licensing. It's about showing that your agency can operate safely, transparently, and within the scope of Minnesota law from day one. Once your agency is licensed and operational, it will be reviewed by the Minnesota Department of Health through a home care survey. Surveys are conducted to confirm compliance with Minnesota home care laws and regulations. Licensed home care providers are surveyed at least once every 3 years, and agencies operating under a temporary license are surveyed within their first year of providing services. Surveys may include review of policies and procedures, review of client records, service plans and documentation, review of staff files, training and competency records, interviews with staff and, in some cases, clients or representatives. MDH uses the same survey and self-audit forms that are publicly available, allowing agencies to review expectations in advance. Surveys are unannounced and may occur at any time. Starting a home care agency in Minnesota is very achievable, but success depends on choosing the correct path, building compliance from day one, and understanding the rules before you apply. Remember, your services, your policies, your staffing, and even your advertising must align with the law. When it comes to home care licensing in Minnesota, using official state resources is critical. In this next section, I'll highlight the key MDH, DHS, and state resources you should rely on to ensure your agency is built correctly from the start. Thanks so much for watching. If you found this video helpful, give it a thumbs up. It really helps others find it too. Don't forget to subscribe so you don't miss out on more tips and resources. Looking for easy-to-use digital tools for managing home health? Check out my Etsy shop. Link is in the description. If you have questions, ideas, or want to share your experience, leave a comment. I'd love to hear from you, and feel free to share this with anyone who might find it useful. See you in the next video.